My name is Saina Jallo. I'm going to present my health information project information. I work with Erickson Living Community in Green Spring. It has 2,000 residents. The residents' ages range from 65 to 106. Um, we have a skills rehabilitation unit, memory care, assisted living, and long-term care units. In the separate living units, we have patients living in independent apartments. The problem is there is high alert medications that are most likely to cause harm to the residents and to the patients. So according to a research that I did, there's an Institute for Safe Medication Practices report that says although mistakes may not be more common in the use of these medications when errors do occur, the impact on patient can be significant. Based on reports submitted to ISMP, a review of literature, and the experience of many hospitals around the country, the lists of high alert medications include as many as 19 categories and 14 specific medications. Although it is essential to improve the management of all of these medications, some of them have been associated with more harm frequently than others. So because of this problem, in Green Spring, we do not have a patient portal. The proposal is in the process in which the doctors communicate with the nurses about the patient's medication change and the prescription should be improved. We have patients who have multiple doctors managing their health. As described above, we have doctors and nurse practitioners at the medical center who are clueless as to what the outside doctors are prescribing for their patients. Improving communication through information technology will help alleviate some of these problems the nurses encounter. Patients' medication reconciliation is vital for this population, especially those on high alert medication. Developing a patient portal system for residents of Green Spring Village community is my proposal to keep our patients safe. What is a patient portal? A patient portal is a secure online website that gives patients convenient 24 access to personal health information from anywhere with an internet connection. Using a secure username and password, patients can review health information such as recent doctor visits, discharge summaries, medication, immunizations, allergies, and lab results. The stakeholders I talked to were corporate vice president, executive director, financial director, resident lab director, administrator. The supporters were the clinical managers, nurses, and nurse practitioners. Everybody was on board. But the barriers that I faced was some of the physicians. They were not interested in this because they think that this was going to create more work for them. The cost to install the software for our community is $8,000, $30 to $40 per user provider, and cost for training is about $15,000 for 2 weeks. I know it is a lot of money involved, but if we can come up with better improvement for patient communication, that will help. So the timeline for the project was I had 4 phases. Phase 1 was discussion about the project with the team and IT. And then I had a discussion with the clinical managers, the nurses, and the doctors, and education with staff and resident council. The patient portal, unfortunately, will be implemented sometime in 2020. The conclusion: electronic patient portals are web-based platforms that give patients direct access to their electronic health records, potentially creating opportunities for improvement and engagement in their healthcare. Effective use of these portals could result in improved access, self-management, care coordination, and reduced costs. So the lessons that I learned is that both the provider and consumer have concerns about installing the patient portal. The patients were concerned about who's going to pay for the installation fee, whilst the provider's issue is, since this is going to cut down on phone calls to the doctors, if they have to answer all the messages that the patients leave. So everybody has their own issues with what's going to happen. The results is right now, the implementation will begin by the end of the year or early 2020. And bottom line, it is in the best interest of the patients to have a good system, such as to effectively reconcile and communicate about their medications. And I have my references, and I thank you for your attention.
Stop.